Rosacea is another diagnosis that we see quite frequently. It's one of those skin conditions that we really don't know a huge amount about. We don't know how to cure it. We don't know necessarily how it may affect you, but not your brother or your sister. But it typically starts with redness and flushing and blushing. Some people are able to identify some triggers that may flare their rosacea: red wine, spicy foods, acidic foods, changes in temperature, changes in humidity, changes of season. Stress can do it, but everybody's trigger's different. So you may have a trigger of Mexican food, and somebody else may have a trigger of red wine, and there may be some that we can't really identify a trigger. So we rely on the patients to kind of play Sherlock Holmes a little bit, to kind of identify triggers and try to avoid them, or at least know that if I choose to eat or do my trigger, that I may have a flare of my rosacea and notice some redness. Typically the redness is background redness on your cheeks and nose. Sometimes it can be accompanied by acne-like bumps, red bumps, or actually can be some pustules as well across the face. The more severe types will have broken blood vessels across the cheeks and nose that are really permanent. Unless we can treat them with lasers, but there's no really topical medicines that will treat those broken blood vessels. And the more severe type is where actually the nose can swell and become quite large and noticeable and bulbous as well. And that is also a more of a procedural treatment as well.